Good afternoon. Thank you for continuing to be with us. We have so many important updates today. I'm just going to give a few brief ones to move us forward so that we can talk through the data. I also want to echo the governor's and the commissioner's sentiments in acknowledging Juneteenth, which is the day we recognize the ending of slavery in the United States. It is a truly important day for people throughout Rhode Island and throughout the country of every race and ethnicity. So I want to recognize the solidarity of that day. So our case numbers and hospitalizations continue to remain steady and relatively low. We're just passing the window now. That's 2 weeks after we started with phase 2. We have 68 new cases to report. There are currently 123 people with COVID-19 in the hospital. Of these 123 people, 23 are in the intensive care unit and 12 are on a ventilator. Sadly, we have 9 new COVID-19 associated fatalities to report. One of these people was in their 60s, one was in their 70s, 3 of these people were in their 80s, and 4 of them were in their 90s. It's Father's Day this weekend, which is a day when we traditionally celebrate our dads, grandpas, uncles, other father figures, and family more generally. This is going to be a difficult Father's Day for many Rhode Islanders who have recently lost a loved one, and it's been a very difficult few weeks for Rhode Islanders who have lost loved ones. So please keep these Rhode Islanders in your thoughts and prayers today and this weekend. I also want to thank Governor, Commissioner Bonte Green, Secretary Pryor, and everyone else who have worked so hard on the thoughtful approach that has been shared today regarding schools and phase 3. As we continue to take steps in this direction, I want to reiterate the importance of the basic public health prevention principles that we have been discussing and are going to be core to our steps going forward. They're the same things we have been stressing and will continue to stress every day. Stay home if you're sick, even if you have what feels like very mild symptoms. Wear your cloth face covering. Keep it where you keep your keys, wallet, and phone so you remember to grab it whenever you leave home. Wash your hands often throughout the day using warm water and soap, or if they're not available, hand sanitizer or at least 60% alcohol. Do regular environmental cleanings on high-touch surfaces in the different locations that you visit, and use good cough etiquette. Cough or sneeze into your elbow. Something else we've been repeating for a long time is that you should keep your groups consistent and small. While the limits for many settings will loosen in phase 3 when we go there, people can and should exercise personal choice and responsibility. That's what we want to continue to encourage, that shared responsibility and that people can continue making good choices. If you are a person who is more vulnerable to COVID-19 because you have an underlying medical condition or because of your age, it will still be very important to limit how much face-to-face interacting you do with other people. People in these categories and all Rhode Islanders need to understand that your decisions have a role to play in shaping your risk profile. That's the direction that we want to be able to offer to you. What are the decisions that you can make that lower your risk of being exposed to COVID-19? The reality of this virus is that the more people you expose yourself to, the greater your risk of acquiring COVID-19. The more time you spend in places that feel a little more crowded, the greater your risk. So I'll finish with saying that we believe in you, in Rhode Islanders. We know that as we continue forward, as you go to a crowded place or see that people are not distancing 6 feet apart, you can make your own decisions about turning around and keeping yourself and your families safe. Let's continue to encourage that, celebrate where we have done well, and keep going forward to keep us safe.